Доброго дня.
Good afternoon. This is Media Center Ukraine, Odesa. We continue for today with the briefing dedicated to opening of women's antenatal clinics with barrier-free access for victims of violence during the military conflict, IDPs, and people with disabilities. Our first speaker is Anzhela Popadyuk, Deputy Director of the Healthcare Department of the Odessa Military Administration. I'd like to welcome everyone. Barrier-free access is the obligatory conditions for all institutions, and we continue to ensure barrier-free access to the houses according to the updated construction norms that took place on the 1st March of this year. So this means that all institutions dealing with healthcare of the region must ensure barrier-free access for all categories of population. The changes are related to the construction of new hospitals and the new principles. And this is not only about installation of ramps. Buildings should be protected, take into account barrier-free principles with wide corridors, doorway openings, elevators, navigation systems, including order pointers. For the needs of people with reduced mobility, they are arranged separate sanitary and hygienic premises, and the braille signs and congruous breathing. I believe that lately, during visiting a hospital, polyclinic, or primary health care center, you saw it. Compliance with the new conditions of the National Health Service is about being patient-friendly. Departments in the hospital should not be scattered chaotically, but should be located according to how they are interconnected with each other. That is, according to the patient's route, which will significantly affect the time and convenience of the patient's delivery. Therefore, today, the opening of any branch or department takes place taking into account inclusiveness for all categories of the population, which is an obligatory condition to conclude agreements with the National Health Service of Ukraine. The Department of Health controls the barrier-free issues in healthcare institutions of our region. And this year, in spring, the Odessa region saw new clinics for women in the framework of humanitarian response to the UN World Population Fund, with the support of the Minister of Foreign Affairs of Denmark and organizational support of the Department of Health of Odessa Regional State Administration. Such clinics already operate on the base of Dobroslavska multidisciplinary hospitals, intensive treatment, Saratska Central Hospital, Belayevska multidisciplinary hospital, Ismail City Central Hospital, and in the maternity house number 7 in Odessa. In these clinics, all the women can get quality gynecological services, and including if they have different issues with the mobilities. Such clinics are arranged with the due consideration of all distances and standards for people to be able to use them on a wheelchair. Their entrance is wide enough, and gynecological chair is mobile. So the level can be changed to make it comfortable for women. There are handrails, mobile walkers, mobile hydraulic elevators. All of them are located at a level that will be comfortable for women on wheelchairs and for women who have no problems with their movement. The clinics, these offices have everything possible to create barrier-free access to gynecological services to all women. Before the start of the barrier-free access office, the medical staff underwent special training on how to help patients with disabilities to feel as comfortable as possible during the examination. Services are provided free of charge to women who found themselves in a difficult situation, including internally displaced women, as well as to women which suffered from sexual violence, in particular in the conditions of war. Additionally, women can receive medications and medical tools free of charge. 144 women have been already examined, including 26 women in the department, in the unit, the Brazilska Polytechnic hospitals, including women with 28 women with disabilities and 42 internally displaced women. In Belyavka multidisciplinary hospital, there were 70 women who were admitted to, including 23 with disabilities, and 17 women were 60 years old, 10 women who use wheelchairs, and 20 women in post-operative room period. As for Saratse multidisciplinary hospital, there were 239 women. In Ismail City Central Hospital, 270. In the maternity hospital number 7, 350 women were examined, of which 60 were operated. I would like to ask all women and girls to refer to family doctor to receive support. We're ready to provide services to everyone, and our staff constantly undergoes training to provide the help that you need. Please take care, and please be safe. Thank you. Our next guest is Lyudmyla Akimova, Senior Coordinator of the UNFPA Cities Project. Thank you. I'd like to welcome everyone. The barrier-free topic is strategic and very important for Ukraine now. And it is confirmed by the development of national barrier-free strategy for Ukraine, and also by a decrease of the Cabinet of Ministers establishing new range of events for 2023-2024. Recently, we've had regional barrier-free conference in Odesa region. And of course, we are proud that now we have the possibility to solve a very important topic, which is related to reproductive women's health. Now I would like to share some numbers with you. That was of 2015, and I think the situation has only deteriorated since that time. We were supported by USAID according to the survey that was conducted in 4 regions of Ukraine: Vinnytsia, Lviv, Zhytomyr, and Kharkiv oblasts. The doctors and women were interviewed, including women that did not have access to women's health services. 74% of women refer to only in acute situations, 26% only once a year, 45 women were examined on band because there was no special equipment, including the gynecological chair. 42% of women were examined in their wheelchair, and only the rest of them mentioned the examination chair. These data shows that in Ukraine we still should do a lot for Ukrainian women to have access to gynecological cabinets, regardless of their weight, illnesses, especially when it comes to pregnant women in their last month, because we need to avoid possible traumas during examinations. And that's why there is the initiative of fund is very important for Ukraine. And I'm really glad that the initiative was supported by the Department of Health, our healthcare institutions, and we can see that over the last month in countryside, in communities, there is a big demand for these services, and we believe that this area will be further developed, but not only with the support of international organizations and foundations. After the regional forum, we have started discussing the regional barrier-free program. We discussed it with the deputies of the Verkhovna Rada, of the regional council. For us to have to be able to install inclusive chairs in every healthcare institutions where women examination is envisaged. This is a challenge of time. We should to solve this, and we don't need big amounts of money. And we believe that with the Department of Health, we will promote this model of offices to make this service accessible. But it is very important not only to have equipment, it is very important to provide quality support to our women. That's why UN World Population Fund, through its partners, Ukrainian Women Fund, the Family Planning Foundation are now train experts, and for the last 6 months, more than 200 doctors from Odesa region have undergone professional training. By the end of June, we are going to have 2 more 5-day training to focus on mental support of the survivals of domestic violence and actual sexual violence during the war. This is important to establish trust, and I'm sure that this will allow to improve the capacity of our healthcare institutions and also to provide such professional aid to our women. Yesterday, we had an unusual day. On the 19th of June, international community celebrated the International Day of fighting sexual violence during the war conflict. This topic is important for many states, but it's a challenge now for Ukraine. The world first celebrated that day in 2015. Ukraine saw that celebration in 2015. But now we have the part of our territory is occupied. There is the war in the country, and the sexual violence is a very important topic when it comes to the war. And it requires attention from all stakeholders related to solving the issues of people facing the tragedy. And the Ukrainian Women's Foundation now organizes the awareness-raising campaign among population, representatives of authorities, healthcare professionals, to provide information to people, for people to refer to doctors, including men and women. And the 280 cases that have been now considered by the General Prosecutor's Office, but we should multiply this by 20 to understand the real situation, because still people are afraid to tell about their personal situations. And some more statistics. We say that the victims of sexual violence are mainly women, but there is the international survey of the occupied territories and on the liberated territories that 60% of the victims are men and boys, and only 40% are women. And when it comes to sexual violence against men, it still needs significant attention in Ukraine. And the UN Population Fund plans, starting from July, to conduct a survey among men to examine the topic, taken into consideration that this is a priority now for Ukraine, especially when it comes to safety and security. A lot of platforms have been created, a lot of institutions dealing with the topic. And now I'd like to say that the people from Ukraine should report about such cases. Do not be silent. This is a military crime. And the sexual violence during the war is not only raping. There are some other signs. So these are the threats, attempts of raping. This is the injuries of gender organs. And this is the forced naking of the people. When our enemies put off clothes from our women to examine them, this is the act of sexual violence. This is the cases of first staying of men and women in one premises. We should talk about this because now we're discussing the algorithm to support such people. And I would like to inform our citizens about the following. If you are the victims or witnesses of such cases, please refer to the national police. Please ask others to refer to the police, as well as to the General Prosecutor's Office, and there is the telephone number. This is online platform Aurora. You need to fill in a short form. Rosary column or mental support. This is the hot line 116 123, where you can get free of charge mental support. The governmental hotline 1547, where you can get informational support. And this is also the hotline to support women's health. Telephone number 333 from 10 a.m. to 6 p.m. Where the people can be referred to also healthcare institutions. And now there is at Kosevska 2 Street, there's the center where all IDPs can get support. And especially when it comes to identifying the effects and cases of the domestic violence, and there is the telephone number that can be used to refer. And now I would like to show this information for everyone to see the contact details and to provide this information to those who need this support. And the offices that we've created, as well as the units for complex healthcare, are aimed to identify such cases and to provide quality mental and other types of medical supports to victims. And people can also be referred from there to get legal social support. That's why it is very important for people to know that they are not left on their own with this strategy. There's the authorities, the medical units where people can refer to. The information is published on the websites of the communities where people reside, and people can refer there to receive support related to sexual violence, to mental support, family planning, etc. And it is very important for mass media to be involved in awareness-raising campaign. It would be great to have more TV programs dedicated to this topic for us to support people in need. And I would like to thank all the partners, NGOs, because in the Odesa region, the implementation partner of is the movement Vira, Nadiya, Lubov, and this is the Women Health Foundation, the Ukrainian Women's Foundation, the Department of Health, and also our healthcare institutions who participate now in this project in the Odesa region. Thank you. Thank you too. And now I would like to give floor to Tetyana Moskalenko, Director of Maternity Hospital 7, Doctor of Medical Science. And nowadays in Maternity Hospital 7 of the Odesa Municipal Council, we have the clinic that is ready to support women and girls in a difficult situation. And there they can get complex medical aid and also aid to people with disabilities, and also to internally displaced persons that require not only mental support. They can get gynecological aid. Since February, more than 300 women have addressed the mentioned unit, who also received aid according to their needs. They were examined by doctors to determine the cancer of breast cancer. And there is also the children gynecologists. More than 60 women required surgery. And women, the victims of rape, can also get aid there in terms of AIDS, etc. We have a wide spectrum of medication like antibiotics, etc. for these women. There are 6 doctors in the cabinet, and with the support of the Charitable Foundation in the framework of the implementation of project mitigating consequence of the sexual and gender caused violence in Ukraine, have undergone offline and online trainings in Kyiv and in Lviv. And you can visit our doctors subject to previous registration from Monday to Friday. You can find our telephones on the website of the City Municipal Council of our maternity hospital in the information brochures. I would like now to ask all women to refer to us. We are ready to support you. Thank you. Thank you. And now I would like to give floor to Ihor Ryazantsev, Director of the Odesa Regional Perinatal Center, PhD. Good afternoon. I'd like now to share information about the project Mobile Brigades for Gender Health, which is implemented by UN Population Forum and in cooperation with local authorities with the support of the charitable organization 100% of Health. It is introduced on the basis of the prenatal center of the Odesa Region Hospital. It was launched in December 2021 with the signing of memorandum of the above-mentioned administration and the Department of Health. Our mobile brigades have contemporary ambulance that has everything needed to render medical aid. It has the all needed equipment, including the ultrasound, etc. We can also take express tests for syphilis, HIV, and hepatitis. More than 8 visits have been made since the start of the project, including 40 in Odesa Raion, in Belgorod-Dnistrovsk 14, Rozdilna 8, and also Belgrade, etc. 1,194 persons have referred to us. 1,297 consultations have been conducted, including the therapeutics 907, 658 for gynecology, family planning, etc. We also provide consultation support when it comes to gender-based violence. 671 examinations have been conducted for hepatitis, HIV, syphilis, glucose test, and also the electric cardiography. Those citizens who refer to us then re-referred to Odesa, for example, regional hospital and some other institutions. The main risk, and these are gynecological pathology, 616 cases, including 52% that were detected first. Then the cardiovascular diseases, more than 500 cases, including 40% that were defined for the first time in a patient. We also have seen cases when the emergency care was needed to hospitalize patients. It is very important work because now we have found ourselves in the situation when people don't have enough time or they don't have such opportunity because of the breach of communication. We visit remote villages where there is the lack of medical staff. People now have the possibility to be examined by professionals of our regional hospital. This gynecologist, a cardiologist, neurologist. And when people learn that they can, for example, have ultrasound, they are more than eager to do this. We also provide support in the form of medication. Says thanks to the support of the NGO 100% Health and the UN Population Fund, foundation people can receive such medications in their villages, as well as other type of professional support. And I also like to say that we have more than 4 years in our hospital, the clinic related to the gender violence. Women refer to us, women who see the problem, and they can get support anonymously. Women are examined for hepatitis, HIV, syphilis. Thank you. We continue our work. Do we have any questions from our colleagues? The floor is yours. Michael Vasura, Newsweek Journal. Those people who receive support from you are from Odesa, or are they IDPs, or are they from temporarily occupied territories, or are they from Mykolaiv and Kherson regions? So what is their origin? The geography of women who have used the services of the mentioned clinics is quite wide, including the Kherson region, Nova Kakhovka, those who have been evacuated because of the tragedy at Kakhovka, HPP dam. We have a lot of people from Kharkiv, from Mykolaiv. We also have women from Crimea, from Donetsk, Luhansk, Kharkiv oblasts. And the 70,000 of IDPs have moved to Odesa since the full start of the full-scale invasion, and since 2014, 117,000 of IDPs have been here in Odesa, and more than 200,000 in the Odesa region. So the geography, the range is very wide. From every part, we have people who have used this opportunity, and the feedback is very positive. And people are usually at a loss when they refer to the center, when they refer to mobile brigades, mobile teams, where they can be when they can receive aid, when they can be registered. And Tetyana Moskalenko has already mentioned that a huge number of people have been operated for a tumor, for example, And now we have the increased, twofold increase of women disease related to cancer. Because of the stresses, the number of cases have significantly increased. Women should refer right away. Of course, the war will be over. Of course, we will win, but it is very important for our women to be healthy, and we need healthy children that can give birth to children, because of the significant damage to the population of Ukraine because of the war. And we also have women who fight in the armed forces of Ukraine. And we have the biggest amount of women in the Europe compared to other European armies. 5,000 of women are now on the front line, and we understand the condition. And this will be the challenge when it comes to women's health, to reproduction. We should get ready to this. We need to support these women, and we should be trained accordingly. And the systematic, the international fund showed the example how the cooperation between authorities, government, with the technical support of the UN Population Fund can lead to positive result for our children, for our people. That's why I would like to call to everyone to be more individual in this work. Thank you. That was the last briefing for today. I will stop here. I would like to thank our speakers. See you next time.
Дякуємо вам.